Good evening, all the participants. My name is Tariq Siddiqui, and I represent the product and marketing function in Collins Learning. Today, I welcome you to this webinar on occupational wellness, maintaining a work-life balance from a series of webinars being conducted in health and wellness space by Collins. In case if you've missed any of our previous webinars, you can find them on Collins Learning official YouTube page. Here's a brief introduction of our resource person for today's webinar, Ms. Geeta Dalal. Ms. Geeta Dalal is a psychologist, a special educator, and a dyslexia therapist who has changed the lives of innumerable children and their families through her years of work. Her list of academic achievements is long and impressive. Masters in Clinical and Industrial Psychology, BA in Special Education, dyslexia therapist, and a certified arts-based therapist. But what is truly remarkable in her patience and enthusiasm to constantly engage with students, guide teachers, counsel parents, while never slacking in her pursuit of knowledge. She's a brain gym and movement-based learning instructor and a drum circle facilitator. So let's welcome Ms. Dalal. Over to you, ma'am. Wish you best of luck.
Thank you so much for that welcome. And welcome to all the participants also who have taken out time to listen to me and to Collins for this opportunity. So topic today is occupational wellness, and occupation to my mind is just what somebody does. So the connotation comes about as office work or work in a factory or something like that, but it really is not that. Because occupation, each one has an occupation. Sometimes ladies working at home and not working outside the house feel that I do not have an occupation. But that really is not true. So their occupation is to look after the house, which they do very well. They don so many hats of a mother, a caretaker, and that is their occupation. They cook and amazingly well. The student sometimes says, I am just a student and I have no occupation. Do you think that's true? Not really. A student's occupation is to study, because that is exactly what he's supposed to do at that age. So occupational wellness is our topic. And wellness is all about looking after ourselves, which means there has to be a balance in our occupation, in our personal lives, in our social lives, and in everything that circles around us. So that, to my mind, is occupational wellness. So life by itself is about balance. And too much of anything or too less of anything does not create a balance. To have a perfect setting, one has to be able to say enough of this and over to something else. And believe me, this balance has not to come from outside factors. If there is balance within, then all kinds of balance will be maintained. Self-management is the first requirement. If I can look after my personal needs, which start from eating on time, sleeping on time, exercising on time, drawing up my routine and following my routine, then definitely I am managing myself. Time management. How well can I manage my time? Can I prioritize it? So as a student, can I prioritize that this homework has to be submitted on Wednesday and the other homework has to be submitted on Saturday? So which one do I do first? Now, as a housewife, I start cooking dinner first or I start cooking lunch first. I have to manage my time. I have to prioritize it. So in the office also, each one has to prioritize which day's work has to be done on which day Without any procrastination, if things can be managed, things run smoothly and there will be no stress. Other than that, if stress does occur, which occurs in everyone's life, you had last week heard my colleagues talk on Colin's website about stress and what it does to our body and why it is extremely necessary to manage that stress. So situations remain same for so many people. It's our reaction to those situations which either lead us to stress or just lead us to eustress, as we call it, which motivates us to work better. If eustress cannot be managed and it continues for a long time, that what happens in the body is called stress, and that is also known as distress. Change management. Any slight bit of a change in routine, are we able to manage it? Are we able to manage that today I have to suddenly close this meeting and take up another one? The Hindi teacher has not come and the maths teacher is going to take 2 periods. Am I going to be able to manage that? Change in my routine, change in the sleep routine, change in dinner timing. If I cannot manage, it might cause me stress. Technology, my God, the amount of tech that has come in our lives since last March is amazing. Not only has each one learnt it, each one is becoming a pro at it. But then to manage it, if we do it well, no stress at all. If we do not manage it, what happens is what is called FOMO, the fear of missing out, which keeps each one hooked to wanting to check WhatsApp and Instagrams and Facebook time and again, and that does cause stress. And last but least, the last on the priority list is leisure management. Are we able to look after ourselves and give some time to ourselves? Are we able to stop and smell the flowers? If we can, we are safe, good to go. So like I was saying, and like my colleague had told you last week, response to situations come in 2 factors. Either you fight it out by preparing yourself. You keep yourself ready to face situations, whether it is a coronavirus or it is a test which is coming in the exams or a boss who suddenly calls me to his office. If I am prepared, I'm ready to fight it. If I'm not prepared, I'm ready to fly. And that flight situation is a form of escapism, because what happens in that condition is we don't want to face it, we just want to run away from it. Believe me, sometimes it may not be possible to run away from situations. And then this third one, definitely in so many situations we face it. We freeze. We are so stressed. The neurons in the brains are so tired that they really can't even decide whether I stand here and face the dinosaur. Am I prepared to face the dinosaur? Or do I see the dinosaur and run away? So I just stand there, frozen, and do nothing. Have you heard of people who are kind of dumbstruck with situations and just cannot open their mouth? Or have you heard of students who lose track in the examination and then they can write nothing? They just forget what they had studied. I would like to tell you something about the brain under stress. I will not talk much about it because my colleague last week has told you a lot about it already. But there are 3 things in the brain which is very important to understand. That all sensory messages come through the sensory pathway and they enter the brain. So if this is my brain and these are my sensory pathways, the one shown in red is the survival brain, which is ready to take in the messages at all times. So messages are taken in, and all those situations which have to work on their own, like the heartbeat, the breathing, these are all things which come from the brain stem, which is called the survival brain. And as long as the survival brain is working, we are all alive. The second part of the brain, once the messages have come in, they enter this area which is called the amygdala. And in the amygdala, that what the red brain has decided to fight or to fly or to freeze, action upon the amygdala comes from there, which is shown in the blue. And that is known as the limbic system or the emotional brain. And all our emotions are connected to the amygdala. From there we decide, how do I feel about it? Am I comfortable with the messages that I've received? Am I okay with it? Am I happy? Am I distressed? Am I good to go with it, or I want to do nothing about it? So if this area, the amygdala, is not happy, the messages that have come from here get stuck here, and they do not pass smoothly to the top part of the brain, which is the prefrontal cortex or the executive state of our brain. It is the executive state which has the language area, which has the organization and the sequencing, which has all those areas from which we work to show an output. So if the blue brain, the amygdala, is in a shutdown mode, can you imagine what the prefrontal cortex can do? And that is where, while talking, we might fumble. While writing, we may not be able to write well. While reading, we may not be able to read well. And so, any occupation takes a back seat from the prefrontal cortex if the emotional brain is not under a conducive situation, even though the messages have come in through the survival brain in the right manner. One needs to understand what are the things one can control in life and what are the things one cannot control. What are the things that are within me to look after for myself, and what are the things that I cannot control? So I have given one example of a filled in sheet in which some things are written of things you can control and things you cannot control. This has been done by somebody else. I would give each one of you 2 minutes, exactly 2 minutes, to draw a quick circle on your papers. Put down inside it, what are the things you can control? Can you control your sleep, your food, what you talk, what you say to others? And outside, put down, what are the things you cannot control? Maybe your boss's mood, your teacher's mood, coronavirus, something that you cannot control. You cannot control the virus, but you can control looking after yourself by washing your hands, wearing a mask when you go out, having a bath once you've gone out. So can I give you 2 minutes to just fill that up? Go ahead.
Shall we take responses?
Of course, yes, please go ahead.
Okay, so just waiting for any responses. We've got the circle where all of us need to fill up. And yeah, please share your thoughts and I'll share that with mine. Just waiting for responses. Okay, Ms. Dala says, can control my anxiety.
Wonderful. Thank you.
That's the first answer. Looking for more answers. Okay, on Facebook, we've got the first one from Miss Pavni. She says, can control her thoughts, keep them positive. Tulika ma'am says, I can control my reaction to situations. Shweta ma'am says, I can control how others react to my situations.
Good.
Yeah. And many other answers. Gurneet ma'am says, situation, weather, natural calamities. Perhaps that is what she cannot control.
Yes.
Shweta ma'am says, I can control how I respond. Lalita ma'am says, I can stay positive. And here on Zoom, we have Venkat, Krishnamal Venkat, who says, control anger, that she can control anger.
Isn't this wonderful to just realize what are the things we can control? So once we realize that, we have empowered ourselves, and the first step itself that we can do something about these situations. Whether it is anger or positivity, you can do something about controlling yourself. And what you cannot control, you have put down natural calamities or whatever else you have written. If you cannot control, is it worth it to just, go on harping about it because you are still not going to be able to do it, right? So this control has to come from within. And for a long time, if this situation of wanting to control things which are not within our control and creating a state of balance between the physical and the emotional state of the body, leading to mental exhaustion, over a long term, if this continues, then that leads to a burnout situation. Because I am sure many of you working in the offices or women working at home, when there was no house help in the initial days of the lockdown period last year, went through this burnout situation. Students went through burnout because of suddenly getting onto Zoom calls and technology or Google calls. Offices shut down, but work was from home. It had no set timing. Didn't that cause a burnout? Because anything over an extended period of time which becomes demanding leads to a burnout. It can be controlled if we realize it, like if you have put it in this, what you can control. So before that complete matchstick in the picture is exhausted, we can do something about it. Because burnout will manifest itself in physiological ways. You can get ulcers, you can get gallbladder pains, you can get lower back pains. It can work out in behavioral manners by getting angry, talking loudly, lashing out, throwing things. Can come out in psychological ways that you are just not comfortable, you have a shutdown mode, you want no connection with friends, you don't want to eat on time, you don't want to sleep on time. It can come out in spiritual ways. Either you lose trust in whatever you were believing in. If you believed in a temple or a particular god, you lose trust that person or that temple or that god or goddess is not helping me, so I'm not going to believe. Or it can go the other way around, that I believe so much in it that I start doing so many things on the spiritual pathway, because too much or too little of anything, like I said in the beginning, is not a balance. And worst is, it can manifest itself in a clinical situation, which will be very bad. It can lead to any kind of a mental disorder. So we have it within our control to follow the 3 R's by recognizing it. So many of you who have filled this circle of control have already started recognizing. Second thing is making an attempt to reverse it. And third thing is to build resilience. And this resilience can be built by looking after ourselves, by managing to reverse those things that we have recognized. Self-care is extremely important. You cannot pour from an empty cup, so you need to look after yourself first. You have a family, you have people around you, you have colleagues in the office, but if you are not in a comfortable state, if you do not have positivity within you, do you think you can pass that on? No. You really can't give something that you don't have. So that is the reason why on all flights they say that wear your own oxygen mask first and then be ready to help someone. I know be wanting to help someone is a very, very good intention, but just having the intention always doesn't work. We need to have that which we want to give. So refill and refuel yourselves in certain healthy manners. Engage in behaviors that bring about your own physical health and your own emotional well-being. Reduce your own stress and anxiety. And then, while caring for other people, which is a very, very good thought, never forget that you come first. And believe me, thinking of yourself first is not a very selfish thing to do. It is the necessary thing to do. Because if we know our need, we need to take the steps to fulfill them. And believe me, self-care is not a luxury anymore. There was a time when going to a spa would have been a luxury. Taking time out to watch Netflix, just lying down on the sofa and doing nothing for an hour would be luxury. It is not a luxury anymore. It is extremely imperative that we look after ourselves. This is an activity I would like all of us present here to do this. If you can just draw this rough doodle sketch on your paper, and just an outline of your body. Take 1 minute. It has to be a rough drawing because we're going to scan the body. I think that should be done now. I move on. Now just scan your body, and on the paper that you have drawn on this, just lightly color.
Ma'am, I think we've lost your audio. Hello? I think we've lost your audio. Yeah, now you're good. Yes.
Okay?
Yes.
Okay.
Hello? Ma'am, I think we've lost your audio again. We just lost you for a moment, ma'am.
Okay, am I back now?
Yes, you are.
Okay. So I'm sorry for that. It's in the internet playing up. On that paper, on this diagram, on this one, lightly shade what if you feel, sense in your body, anywhere, any kind of a pain or discomfort. So it could be a headache, it could be a nasal congestion, it could be a chest pain, it could be a foot pain because you've been sitting for so long. If you've been writing or working on the keyboard for a long, the hand or the finger might be paining. Could get into the detail of which finger is paining. And if you wish, you could give it a number from 0 to 10, 0 being no pain and 10 being maximum pain. I give you 1 minute to scan your own bodies, feel your body and see if there is any soreness anywhere. Okay, we move on. This was about sensing. Then just note down. These are just some suggestions. You can choose your own emotions, which are not written here also. What is the emotion that you are feeling just now? It could be multiple emotions. It could be for one particular thing, you're feeling some emotion. For something else, you're feeling a different one. So are you happy? Are you feeling loved? Are you frustrated about something? Are you content? Are you confident? Again, to each of these emotions, if you wish to give yourself a number, please go ahead. So we've done sense, we've done feel, and now we're coming to know. What do you know about yourself just now? Are you confused? Can you find your own pathway? Do you know what you have to do? Or do you think you are in a mixed situation when I do not know? I'm not sure of what I want to do. Is there a yes for everything? Is there a certainty? Is there a no? Or is there maybe? So, what do you know of yourself just now?
Just looking for answers.
They might not give us answers just now.
Yes.
If they keep it to themselves, also, I'm good with it. If anybody wishes to share, please go ahead and share also.
Okay. I think Mac Ma'am says mixed. She's got mixed feelings as of
Okay.
now, and that's from Facebook. So there are many people who say they've got mixed feelings.
Okay, so those who have mixed feeling, thank you for your response, but you can judge. So mixed would also be either a balance of a good feel and a bad feel, or a little weightage on either side. So judge for yourself what it is.
Charu Ma'am says anxious.
Okay.
Miss or Mr. Rathod says mixed expression depends on specific situation. But I think, ma'am, you're asking about what they feel right now.
Right now.
Yes. Kunjan ma'am says these times have made us feel anxious. Okay. So the answers are not about these times. It is about how do we feel at this point in time. Right
Right.
now. Yes.
Yes.
So Lakshmi ma'am says motivated and informative.
Good. Thank you so much for all this. And now I'm going to take you through one exercise. And after that, we are going to scan our body once again. Are you ready for it? Just say yes if you are, or show thumbs up.
Yes.
Yes? Ready? Okay. So this exercise is called PACE. It is from Brain Gym, which has been created by Paul and Gail Dennison. It's a very popular program and a wonderful exercise, which is just about 3 to 4 minutes. The first thing in this is we need some water. So PACE stands for, those who do not have water, you can just get up and get some water, please. So PACE stands for positive, active, clear, and energetic. It is an acronym, but we are going to start the exercise in the reverse manner, in the E-CAP manner. So we are going to start with energy, then clear, then active, and then positive. So the first thing to do is, you can have 1 sip, 2 sips, 3 sips, any amount of water that you wish. The only condition that I lay is, or not me, rather Paul Dennison says is, that when you are drinking this water, keep it in your mouth for a fraction of a second. Just feel it. Be mindful that it is water, and then gulp it down and let it go down through this midline of your body. So realize that there are 2 parts of the brain, there are 2 eyes, there are 2 shoulders, and body is divided into the right and the left sections, and the water is going to trickle down in the center. Let's go ahead and drink some water, please. I would suggest everyone on the platform to do it, only then you will experience the magic of it. Now, the second part is we're going to cover one hand, put one hand on our navel, and the other hand is going to be formed in a C, and we will, this collarbone, below the collarbone, two finger spaces below the collarbone, there are two soft spots. So you're going to put this C there on either side of the collarbone and massage these. Just in case anybody has a difficulty in finding that spot, you can just rub this area where both the points are being massaged, okay? So these are called the K27 points on the body's meridian, or the brain buttons in Brain Gym. And the other hand is covering my navel, and I'm going to look from the left, as far left as I can see, and then move my eyes to the right, increase the peripheral vision while massaging the K27 points. The other hand is on my navel. Keep moving the eyes from the left to the right, and the right to the left. When you think you are ready, all you need to do is just change hands. The hand on the top goes on the navel, the other hand comes on the brain buttons. Start massaging and keep looking from the left to the right, and the right to the left. When ready, we will follow the third part of the exercise, which is crossing the body's midline. Like I told you, we have a midline here. So we're going to cross the body's midline by taking the right hand on the left leg and left hand on the right leg. And keep looking at your hand. You're making brain connections, crossing the midline of the body. Don't forget to breathe. This can be done in any number of ways. You could do this also. So the shoulder moves, the arm moves, and the leg raises. And then the next part is called hookups. So this earlier one was called cross crawls. I'm sorry I forgot to tell you. And here is the next part, which is hookups. In hookups, we first come to the Krishna pose where we cross the feet at the ankles. We cross the feet like this, and then put both hands like this outside with the palm outside and the thumb down. Cross the hands, clasp them, push them inside from the elbow and bring them to your chest. And then we are going to breathe in and out, but while breathing in, we will take the tip of the tongue to the upper palate, and while breathing out, we shall open the mouth in an O. So it will go like as if you're blowing a candle. And if there is no vertigo or epilepsy, you may close your eyes. This can be done sitting down also. So I'm going to sit down and do it, but my feet have to be crossed. When you are ready, unhook your hands and your feet. And then just hold touch each finger like this to the other hand. Bring them to your chest and breathe in the same manner with the tip of the tongue on the upper palate, and while breathing out, open the mouth in an O.
I'm sorry, who am I talking to right now?
When you are ready, you can open your eyes. And we can scan the body again. Once again, sense in your body, is there any ache and pain? Earlier, whatever pain you had noticed, is that pain still there? Is it on the same number or has the number shifted? What are your emotions? What are you feeling just now?
Okay. Okay. I think Arpan ji says no pain, and the next answer is feeling super relaxed. So looking for answers on Facebook. Okay, Pavni ma'am says I feel relaxed. Miss Bhavani says very relaxing. So yeah, I think there's a very good feeling. Sumit Bharadwaj says feeling super relaxed, and Gunjan ma'am says calm. Upinder ji says full body relaxed. Pain reduced. Pain has reduced so much. Is the answers from Facebook?
Wonderful. Thank you so much for your responses. I'm glad you feel like this. And when we talk about knowing, you will actually feel confident and know what you really want. Because you're feeling so relaxed, you're feeling that you have looked after yourselves in these 3 to 4 minutes. So with all my directions, because you went to do it for the first time, it has taken maybe 4 to 5 minutes. I didn't calculate the time, but otherwise it just takes about 3 minutes. Thank you so much for your responses. I can see responses still coming on the chat box. Wonderful. So we're going to do the next exercise, which is called the owl. Again, this is about self-care. The first time, just give, okay. When there is stress in the body stress first comes on the neck and the shoulder. And if you're sitting, you will first start moving your head like this and like this, and you will do this. What else do you do? Doesn't it first attack there? So I'm going to show you one exercise which is going to release these muscles, okay? Because what happens in stress is that the muscles become shorter and you keep moving like this and like this because you want to lengthen those muscles. And if stress continues for a very long period of time, then the muscles become short. And if stress continues beyond that stressful period also, then the tendons below the muscles also become short. So we're going to release those with an exercise called OWL, which is also from Brain Gym. So this area of the shoulder, which is connecting to the neck, here we are going to hold thumb on one side and fingers. I'm going to first start this side. So thumb will be here in front. I'm holding this and 4 fingers behind. And hold it tight, that spot. And move in that same direction, keep the head. And then slowly, like an owl, you will hoot and take the head onto the other side. So I'm holding my neck and shoulder not the neck. I'm holding these shoulder muscles here and and leave it. And now I'm going to hold it on the other side. Keep my head on the same side. You could also howl in a continuous manner. And release. So this is a preview. Let us review it. I'm holding it on the first side again. You could start on any side, okay? Release. Preview on the other side. So after preview and review, the third time is supposed to be the luckiest one. So let's do it once again. Last time on this side. And then just let the shoulders go once or twice. How does it feel? Can we have some responses, please?
Amazing. Amazing again. Wow.
Thank you.
Yeah. So I think everyone is very relaxed right now. They feel much better. They feel very relaxed. And they say they feel nice. Wow. So quite a bit of adjectives there.
Wonderful, wonderful. So you ready for one more exercise?
Yes.
Yes. Okay. So this we have lengthened. First we calmed our own body with pace. Then we lengthen this neck and the shoulder area. And then this is the arm which needs to be lengthened. This is the upper, this will take care of the upper body then. So in this exercise, what we need to do is we lengthen the arm, one arm like this. With the second one, we're going to push it in 4 directions and it'll be like this. If this is my long arm and I'm pushing it from here, this arm is pushing it in the opposite direction. So there's a friction here. So this is pushing this way, this arm is pushing this way. Is that okay? So here you maintain a balance, but both the arms are pushing in the opposite direction. And this we will do on all the 4 sides. So we are not on the shoulder, we are not on the elbow, we are somewhere in between. The push has to come. And this arm has to be straight as shown in the diagram. So we'll start from inside out. So I am pushing it outside, my arm is pushing it inside. And just 1, 2, 3, 4, 5, 6, 7. Then I'm pushing it backward, arm is pushing it forward. 1, 2, 3, 4, 5, 6, 7. I'm pushing it inside, my long arm is pushing it outside. 1, 2, 3, 4, 5, 6, 7. Now on the back side, I'm pushing it forward, my arm is pushing it backward. Long arm is pushing backward. 1, 2, 3, 4, 5, 6, 7. If I may request, join both your hands like this and check your fingers. Are the fingers at the same level or has that arm lengthened? Mine has lengthened a little bit. Check yours. Just write yes if it has lengthened.
Yes. Yes.
Absolutely. So that muscles which were getting shorter, we've lengthened it. So we come back to the other arm. We cannot leave it just on one side. So starting from inside, 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. And put both your arms like this and check. Are they at the same level now or not? Mine are. What happened? You lengthened on both the sides. Alright? So this, I'm doing it only once just now because I'm seeing the time. But if you were supposed to do it, at least thrice on each hand. Is that good to go, Shrikant, if you don't do it thrice?
Yes, ma'am.
Yeah?
Yes.
Thank
Ma'am, there is one question with regards to the first exercise when, we were instructed to make the sound.
Yes.
Padma Kumar Radhakrishnan on Facebook is asking, ma'am, why do we need to make that sound?
Because
Is it
an
necessary?
owl, this exercise is called an owl. So we are exercising all our vocal cords and vocal muscles, and we are also at the same time exercising our eyes by increasing our peripheral vision by looking as far behind to the other side as far behind.
Okay.
So the shoulder, the neck, the eyes and the vocal cords are all being lengthened.
Fine.
Thank you for that question. Our next exercise is called grounding. This is from ACT therapy, which is called Acceptance and Commitment Therapy by Russ Harris and Stephen Hayes. So go for it just now. You could use the chat box or use your own paper. Just name 5 things that you see in your room. I don't need to see the responses, but just respond. 5 things that you see in the room.
Okay, from my side, I see a fan.
Yes.
A mirror.
Yes.
The windows.
Okay.
The doors.
Yes.
And a chair.
Great. Now name 4 things that you can feel against your body or touch around you.
4 things I can feel. They're the external things or perhaps the parts of my body?
Anything. You can feel against your body. So it could be my shirt.
Yeah.
It could be this.
I get that. Yes.
And or I can touch. So I can touch my computer. I can touch my glass of water. I can touch the mouse. So whatever you can see. So name 4 things.
Okay. One is my laptop. Then because I'm touching it right now. The next is the earphone. Someone has written that. Headphone.
Yes.
The next is I can feel my slippers.
Yes.
And also obviously, yes. It's summer. I can feel my shirt now.
Definitely. Wonderful. So name 3 things that you can hear right now.
I can hear your voice when I heard you then.
Yes.
Nothing else because I have my earphones. So, however, I'm sure. Let me just look for other people who can hear many other things.
So in my house, I can hear the sound of the AC, and I definitely can hear some sounds from the kitchen also.
That's rather complimentary. Yes.
Name 2 things that you can smell right now.
Well, I can smell one. There's a bit of perfume over here, so I can smell the room perfume there. That's the first thing. Okay. And second thing, there is water. Obviously, people say we can't smell so much of water. Yes, Nidhi says she can smell tea leaves.
Yes. And ginger also she writes.
She writes ginger. Okay.
Yes. Okay. And name one thing that you can taste. So if you've not eaten for a long time, that still will be the taste of your own saliva from the last thing that you have eaten. If you can think of it and taste it.
Yes. That's what can I taste? A taste
Taste
of
of
water.
water.
A
Very
taste
good.
of water. Chocolate
Very
cake.
good.
I think Nidhi is having chocolate cake.
Okay. So this is called grounding. So this was again just 5 minutes or less than 5. But in these, you exercised all the 5 senses of seeing, hearing, touching, tasting, smelling. And while doing this, you are engrossed. So you're not thinking of anything. You are just here and now. Now comes breathing. It's very important to breathe properly, because all the time it's not that we are not breathing, we are breathing all the time. Like I told you, breathing comes from that red area in the brain, which is the survival brain. That's the brain stem. But when we breathe deeply, then there is a calmness in the body, which is called resting and digesting. Okay. So when breathing is normal, the muscles are relaxed and the heart rate is normal. But think of it. Suddenly a dog comes in front of you. What happens to your emotions? What happens to your body? And what happens to your breathing? So it is important to keep our breath in control if we want calming and if we want rest and digest more. So I'm just giving you few exercises from the breathing point of view. Works very well with children and adults both, because sometimes it is difficult for people to just imagine. They need something kinesthetic. So you breathe in as you slide up and breathe out as you slide down. So breathe in as you slide up and breathe out as you slide down. So this is going to just take 2 minutes. Okay, shall we all go for it together?
Oh, yes.
How does it feel? So you can ask that question if whether you're feeling calm now or not.
Refreshing.
Refreshing. And
Mind relaxed. Mind is relaxed.
Very good, very good. So if you feel like it, you can take 5 more breaths with the other hand, but we won't take it right now in together. Okay, you may go ahead and do it later. Now this is another kind of breathing technique which is called the lazy 8. So you start at the center here, and then like a lazy 8, you go upward in the left direction and then down and back to the nose, that is the center, while breathing in. So your eyes or nose is moving. So while I'm moving on the other side of the lazy 8, I'm breathing out. So breathe in once again on the left. Great. So this is called lazy 8 breathing. And then one more style we can do, which is called the 4-7-8. So what happens in 4-7-8 is that you are breathing in for 4 counts, then you're holding. So far we were not holding. So we hold for 7 counts and then you exhale for 8 counts. So exhalation is more than inhalation, and more than that, there is a stop there where you are holding the breath. This is very simple again, where exhalation is more than inhalation and temporarily slows down the oxygen which goes to the brain, because you're taking in only for 4 counts, but you're exhaling more, that is double the counts, and breathing will come to a rhythm now. Let's start. So you can keep counting on your fingers, your own fingers. I'm doing it in case it helps you, okay? Breathe in, hold, breathe out, breathe in, hold, exhale, the effect is going to be same. If this is done before sleep, this is a very useful one because we are exhaling for a longer time. So try, this is recommended only for 4 cycles of breathing in out. We've just done twice just now, right? We come to eye exercise, which is called Clover, is what I'm going to do with demonstrate just now. This eye exercise is from a program called Vision Circles, which is also from Brain Gym. Before we do that one, since we've been on Zoom call for almost an hour, we should do this 20-20-20, which is the simplest exercise for everyone. Doesn't take much of an effort. So if for 20 minutes you've been staring at a screen, then take a break, look 20 feet away for 20 seconds, and then you can come back. So that is called 20-20. And now we come to this, which is called Clover. So in Clover, we are going to move our eyes from, so Clover is 2 lazy 8s, 1 straight 8 and 1 lazy 8, one over the others, you can see. Clover is always 4-sided. And we will go from number 1 to 2 to 3 to 4. So our eyes have to move in that direction. Number 3, upward, down. Number 4, down and up again. Second time. And third time. How does it feel?
Very relaxing.
That was the idea. Thank you for that comment, and that was the idea. We're going to do one more eye exercise, which I have not mentioned here, but we're just going to do it. You could rub your palms like this and make them warm. Cover your eyes with the palm on your cheeks, the thumb on the side, the temple, and the finger on the forehead. And let the eyes be in complete darkness for a while. When you are ready, You may open one side of the aisle as if you are opening a window shutter. So the window opens just this much. So just open this much. Look far ahead as you can see. Look around, clockwise, anti-clockwise, and then close that window shutter. Breathe in and out. Open the other window shutter. Look far ahead. Then turn your eyes clockwise and anti-clockwise. And close the shutter again. Breathe in and out. Now open both the windows together. Look far ahead. Move the eyes clockwise, both together, anti-clockwise, and then close the eyes. Just take your hands and massage them over your face once. And open your eyes. If you have responses, please put them in the chat box.
Very refreshing again.
Great.
Wow feeling.
Very good. I'm so happy about that. I'm so happy about that. So these are all 2-minute things. And if you want to look after yourself, indulge yourself, take time out for yourself. And now my next one is about inner speech, or what we call self-talk. So each one of us, when we are talking to ourselves, like I'm talking to you at this moment, I may be saying 10 words per minute or maybe 15 words per minute. But believe me, I will be talking 4,000 words a minute in my head. So before you speak out, your mind starts talking. And that takes very less time, because what happens is the mind talk, which is the self-talk, which we are listening ourselves all the time. We do not need complete sentences for that. We do not need the vocal cord movement. We do not need our lips to move, our teeth to move, and our tongue to move. So it goes quicker. And that is the reason why it is about 4,000 words per minute. And think of it. If those 4,000 words, which you are talking to yourself all the time, if you are not talking positive, what are you listening to? If you are telling yourself, I'm bad, I can't do this, I'm no good, I want to learn but I don't know where to start. So if that is what I'm talking all the time, and then when you have to talk aloud, you are saying, I'm not technology driven, but I think I can learn. So there is still hope. But what have you told yourself? What have you listened to? What were the messages you have given yourself? So please be extremely careful when you are talking to yourself, because you are listening even if no one else is. And then we have a self-care bingo. Each one can indulge in this. I'm sure everyone knows how to play bingo, so go for it. This is a ready-made bingo in which you can look after yourself. You can keep ticking mark, whether you've done the first line, second line, 4 corners, third line, central line, diagonal line, whatever line, or you've done the full house. Anything that you do, each of these is a relaxing activity. Each of these is a self-care activity, and never feel guilty, even if you have to do just nothing. Never feel guilty if you feel that you need to ask for help, because it's perfectly okay not to feel okay. Ask for help. So going outside may not be possible just now. If it is possible, go for a walk, but wear your mask. Movie time can be at home. You can sit in front of the television with a bowl of popcorn. You can hug the people in the house. You can play games. Games could be carom, small things like tic-tac-toe, joining the dots, picking up sticks, Monopoly, Chopat if you have it, or Ludo, or Snakes and Ladders. Have fun. If you have a pet, cuddle. Keep drinking water. Water is very important. So each of this is a self-care activity. So play the bingo. Now these are some things which are ready-made. For your family and for each one in the family, give each one the choice to create your own bingo. Draw a grid like this, 5 by 5 or 3 by 3, and let each person choose what relaxes them, and they could doodle it in there or they could write about it. So they could choose their own activities which relax them and play their own bingo. A few other wellness tips. I'm sorry, it's 5:35 already. So these are many other things which can be done for self-care, which will lead towards wellness, which will lead towards occupational, personal, social wellness. And if there is no stress in life, it's a happy life. And the ultimate aim of anyone is joy in life. If you have any questions, I'm happy to answer.
Not
I'm
many.
sorry, it's 5:35.
Not at all, ma'am. Not at all. All of us are thoroughly involved in all the brain gym activities and also the interesting bingo game for self-realization that you've suggested. Yes, it's the first question. Without further ado, is from a teacher who'd like to address her students online vis-a-vis exercises. So her question is, ma'am, could you suggest certain exercises that can be done online?
All of these that I've done with you, I have done with you online. So I work with a school, and in our school, our teachers do them online with the children. Of course, when live classes are on, and if parents have come even for an orientation, I do it with the parents also. Because these are all relaxing exercises you can do anytime. They are open for any age group. Simple things like cross crawl and all also. Our Malishwala Bais also used to do it when they used to give a massage to little babies. So it's just that it is more structured now. So it can be done in any position, lying down, sitting, or standing.
I think that answers Ms. Mehak's question. So she asked, can we do this with students? Yes, obviously you can do all these with students.
Yes, of course.
Yes. And the next question is from Arpit. His question is, please, can you ask ma'am to suggest some other sound practices? The last one really helped.
What practice?
The first exercise where we had to make sounds. The owl. Yeah, the owl.
Okay,
Yes.
I definitely will think about it, and I do not know which way to connect, but I definitely will think about it. So anything to do with the voice gives a relaxation to the vocal cords, because from time to time the vocal cords also need stretching. So offhand I can just think of one more from Brain Gym again, which is called energy yawn. So if you give me 1 minute exercise, so below this mandibular joint there is a soft spot. Okay, I have a big one because my cheeks are really huge and soft and spot. So like we have the tendency to yawn when you are tired, you can have just lift your neck up like this
and below the mandibular joint in this soft jaw, hold this spot and open your mouth and on purpose yawn and make a sound. So it will go like, and massage also.
And check how it feels on the back muscles, on the shoulder, neck, mandibular joint, below the joint, and then the vocal cords also.
Great. The next question is about self-talking.
Yes.
So there is one teacher who asks if self-talking is good, and your thoughts about it.
So self-talking for a certain limit, everyone does. Whether you like it or you don't like it, it is happening. So from the time you have started talking, okay, self-talk starts happening. So initially, self-talk is always loud talk. So if you see little children playing with the doll also, they will be talking all the time, but they will be talking aloud. So my doll is going to sleep now, and my doll is going to hold my hand, and my doll is going to cook now. So they are playing alone, but they are talking. And as they keep growing, from whatever societal pressure that we take or we give to the children, they start holding back their thoughts and only giving us some thoughts aloud. So that is where that self-talk remains the talk within. So before responding, 4,000 words come to mind. And like I said, those are not in sentences, and they do not need the physical parts of our body to be exercised. So, they run very fast. So they have to be positive. Try and make them positive. Otherwise, use the power of the word yet. So if you're just telling yourself that, okay, I'm overweight, don't keep saying I'm overweight, I'm overweight, I'm overweight. I have not lost weight yet. So the power of yet, keep it open, because yet has a lot of power.
Positivity too, I think.
Absolutely.
Yeah?
Yes.
Positive self-talk, perhaps. And ma'am, there you go. The next question is, this has been asked by many people. How many times in a day must we practice the brain gym exercises? Is there a time number there?
No, there is no time limit to do it. There is no age to do it. There is no fixed duration of time to do it, and there is no fixed number of times to do it also. And also the PACE exercise, it was a thing of 4 parts, PACE, but each one can be done individually also. So in a classroom, if you have children and you have, say, entered a classroom, okay, or in an office also, you are coming for a meeting, but you know that your teen has been sitting on a Zoom call for like 2-3 hours. So you can just ask everyone to do this, and then this, and this. You may not count for 7 counts, but you are still just stretching. Or you could even just help each other out. That, if your colleague is sitting and you are kind of helping, you are pushing both the arms inside and the colleague is pushing them outside. So, you're helping each other. So these exercises, as long as you need to feel relaxed and as many number of times as you need it.
Yes. Ma'am, I just would love to, in conclusion, read this. This is from one of our attendees over here, a participant on Zoom.
Yes.
She's Kalpana ma'am. Ma'am says, lovely session. After all, brain gym exercises and listening to Geeta ma'am talking, all my body aches seem to vanish and I'm sensing a new me.
Wonderful. Thank you so much for that. Thank you. Keep being like that and keep doing these exercises, because you're all 1 minute, 2 minutes. I mean, in an hour, we have spoken so much and we've still done so many exercises.
Exactly. And see how productive an hour that is well spent can actually be, isn't it? Thank you so much for actually helping all of us. In fact, all the teachers are here, all the parents and students whosoever is attended, relax after this wonderful session. I'm sure all of them are motivated to take up brain gym activities for their students and also for their near and dear. And perhaps that will help them stay strong during these troubled times. Thank you so much.
Very much, very much.
Thank you so much for this wonderful session, ma'am.
Thank
And
you so much. Yes.
and to all the teachers, whosoever has been asking us to share the video of this, if you want to access it on YouTube, you'll have to follow us on a YouTube page, Collins Learning India, and you'll see this video and all the webinars that we conducted uploaded there. But if you want to see it immediately, the video is live on Facebook, and once the live session is over, it will still stay there on Facebook, so you can access it there on Facebook too. So this is how all of you can actually gain access to the wonderful session that we had of Geeta ma'am. Thank you so much, ma'am, for a wonderful session. Yes.
Thank you very much.
Yes.
Thank you.
And tomorrow is Eid. Wish all of you a happy Eid. And we just hope these terrible days are quickly behind us. I just hope that happens. Wish all of you a safe week ahead. Thank you so much.